A few years ago, a patient of mine, I'll call her Margaret, 74 years old, sharp as a tack, still gardening every weekend, came into my office looking worried. "Doctor," she said, "I don't understand it. I haven't gotten sick, I haven't had an injury, but I can't get up from a low chair without pushing off with my arms anymore. Getting up the stairs to my porch has become something I plan for, instead of something I just do." Margaret wasn't imagining things, and she wasn't alone. What she was describing has a name: sarcopenia, the gradual, often silent loss of muscle mass and strength that comes with aging. And here's the fact that surprises most people when I tell them: after age 30, we can lose 3 to 8% of our muscle mass per decade, and that rate accelerates after 60. By the time many people notice it, they've often already lost a substantial amount of leg strength, because the legs, the muscles we rely on most for standing, walking, and balance, are usually hit hardest and earliest. I'm a physician, and I've spent much of my career caring for older adults. I want to talk with you today not to frighten you, but because this is one of the most preventable and modifiable conditions I see, and yet it's one of the least talked about. We spend so much time discussing heart disease, cholesterol, and blood pressure. We don't spend nearly enough time talking about the muscles that let you get out of bed, climb stairs, carry groceries, and simply live independently. That changes today. So what exactly are we talking about? Sarcopenia comes from Greek roots meaning poverty of flesh. In plain language, it's the loss of muscle mass, muscle strength, and physical performance that happens progressively as we age. It's different from simply getting weaker because I'm out of shape. Sarcopenia is a distinct, recognized medical condition, one that can occur even in people who were once quite active, and one that has real, measurable effects on the body. A related term you may hear is dynapenia, the loss of muscle strength specifically, which sometimes happens even faster than the loss of muscle size. In other words, your muscles can look relatively unchanged, but still be noticeably weaker than they used to be. Why should you care about this, even if you feel fine today? Because leg strength, more than almost any other single measure, predicts how independently you'll be able to live in your 70s, 80s, and beyond. Weak leg muscles are strongly linked to falls and fractures, loss of independence, needing help with daily activities, slower recovery from illness or surgery, higher risk of hospitalization, even, over time, higher overall mortality risk. This isn't about vanity or fitness in the way we usually think about it. This is about whether you can stand up from the toilet unassisted at 85, whether you can catch yourself if you trip, whether you can keep living in your own home. That's what's at stake, and that's why this deserves your full attention. Let me explain what's actually happening inside your body, and I'll use a simple analogy to make it click. Think of your muscle tissue like a busy construction site. Every day, your body is breaking down old muscle protein and building new muscle protein, a constant renovation project. When you're young, the construction crew works efficiently. Building tends to slightly outpace or match breakdown, especially if you're active and eating enough protein. As we age, several things change. First, the crew gets smaller. Our bodies naturally produce less of the anabolic hormones that stimulate muscle building. Growth hormone, testosterone, and insulin-like growth factor all decline with age. Less hormonal signal means less building activity. Second, the blueprints get harder to read. This is a phenomenon called anabolic resistance. Even when older adults eat protein, their muscles don't respond to it as efficiently as younger muscles do. It's as if the construction crew needs a bigger delivery of materials to do the same amount of work. This is a critical point I want you to remember, because it directly affects what we recommend for diet. Third, the nerve wiring deteriorates. Muscles are controlled by motor neurons, nerve cells that tell muscle fibers to contract. With age, we lose motor neurons, particularly the ones connected to fast twitch fibers. The powerful fibers responsible for quick, strong movements like catching yourself when you trip or pushing up out of a chair. This is one reason why strength and power often decline faster than sheer muscle size. Fourth, there's chronic low-grade inflammation. Aging is associated with a subtle rise in inflammatory markers in the blood, sometimes called inflammaging. This inflammatory environment actively promotes muscle breakdown. And finally, inactivity accelerates all of it. This is the part we have the most control over. Sitting for long periods, avoiding weight-bearing activity, and general physical inactivity dramatically speed up muscle loss. It becomes a vicious cycle. Muscle loss makes movement harder, which leads to less movement, which leads to more muscle loss. Why the legs specifically? The large muscle groups in your thighs and hips, the quadriceps, hamstrings, and glutes, are your body's primary anti-gravity muscles. You use them constantly, but you also lose them disproportionately fast, partly because many people's daily lives simply don't demand much of them once they're no longer doing physically demanding work. 4. Symptoms and warning signs. Sarcopenia often develops quietly, but there are signs your body gives you. Signs I want you to take seriously rather than write off as just getting older. Common early warning signs include needing to use your arms to push yourself up from a chair or the floor, feeling that stairs, especially going up, have become noticeably harder, a weaker grip strength, struggling to open jars, twist doorknobs, or carry grocery bags, noticeably slower walking pace than in past years, a general sense of shrinking clothing size in the legs, even without significant weight loss, increased fatigue after activities that used to feel easy, a growing fear of falling, or actual near falls or falls. When should you seek medical attention? I'd encourage anyone who notices a new or accelerating decline in physical function, particularly if it's happened over a matter of months rather than years, to bring it up with their doctor. This is especially important if you've had an actual fall, even a minor one. Unintentional weight loss, a hospital stay or period of bed rest, a new difficulty with tasks you used to do without thinking. None of these symptoms mean something is necessarily seriously wrong, but they are your body's way of raising its hand and asking for attention. And early evaluation gives us the best chance to intervene effectively. 5. Diagnosis and medical evaluation. If you bring these concerns to your doctor, here's generally what evaluation looks like, and I promise it's not complicated or intimidating. A functional assessment. This is often the most valuable and simplest tool. Your doctor may ask you to rise from a chair 5 times without using your arms, the chair rise test, walk a short measured distance at your normal pace, gait speed test, grip a small device called a dynamometer to measure hand grip strength, which correlates surprisingly well with overall muscle strength throughout the body, a review of your history. This includes recent weight changes, activity levels, appetite, any falls, and chronic conditions that might be contributing. Body composition assessment, when needed, using tools like DEXA scans, dual energy X-ray absorptiometry. The same machine often used for bone density, which can also estimate muscle mass bioelectrical impedance analysis, a simple, non-invasive device some clinics use. In some cases, ultrasound imaging of specific muscles. Blood work may be done to rule out other contributing causes, thyroid problems, vitamin D deficiency, anemia, or inflammatory conditions, since these can worsen or mimic muscle weakness. The good news is that most of this evaluation is quick, painless, and can often be done in a routine office visit. There's no need for fear about this process. It's about gathering information so we can build the right plan for you. 6. Treatment and management. Now let's talk about what actually works, because this is genuinely one of the more encouraging areas of geriatric medicine. Sarcopenia is not an inevitable, unstoppable decline. It responds to intervention, often remarkably well, at almost any age. Resistance exercise is the single most powerful tool we have. I want to be very clear about this. No pill, no supplement, and no single food replaces resistance training as the primary treatment for muscle loss. Research consistently shows that even people in their 80s and 90s can build meaningful new muscle strength through structured resistance exercise. Squats, leg presses, resistance bands, or bodyweight exercises like sit-to-stand movements. Studies of nursing home residents in their 90s doing supervised strength training have shown genuinely striking improvements in leg strength within just weeks. The key principles: target the major leg muscle groups, quadriceps, hamstrings, glutes, calves. Aim for 2 to 3 sessions per week, with rest days between progressive overload matters, gradually increasing resistance as strength improves. A physical therapist or qualified trainer can help design a program suited to your current ability and any joint or health limitations. Protein intake and timing matters more than people realize. Remember that anabolic resistance I mentioned? Because older muscles need a bigger protein signal to respond, we now generally recommend that older adults consume more protein per meal and distribute it more evenly throughout the day, rather than the common pattern of a light breakfast, moderate lunch, and protein-heavy dinner. This is where the idea of eating something specific in the morning actually has real science behind it, just not in the miracle food sense. Many older adults eat very little protein at breakfast, perhaps just toast, cereal, or coffee, and then get most of their protein at dinner. Because of anabolic resistance, that pattern likely understimulates muscle protein synthesis for much of the day. Building a breakfast that includes a meaningful protein source, eggs, Greek yogurt, cottage cheese, milk, a protein smoothie, or even leftover lean meat or fish, is a genuinely evidence-supported strategy, not a fad. General guidance from research in this area suggests aiming for roughly 25 to 30 grams of protein per meal for older adults, 3 times a day, rather than one large protein-heavy dinner. Vitamin D also plays a role, since it's involved in muscle function, and deficiency is common in older adults, especially those with limited sun exposure. Your doctor can check your levels and advise on supplementation if needed. Omega-3 fatty acids have some evidence supporting a role in reducing inflammation that contributes to muscle breakdown, though this is an area of ongoing research rather than settled fact. Managing chronic conditions, diabetes, thyroid disease, chronic kidney disease, heart failure, is also part of the picture, since these conditions can accelerate muscle loss if poorly controlled. Medications are not typically the primary treatment here. There is no currently approved muscle-building drug for sarcopenia, the way there are approved medications for osteoporosis, for example. This is an active area of pharmaceutical research, but for now, exercise and nutrition remain the evidence-based foundation. I want to emphasize, the right combination for you should be worked out with your own healthcare provider, taking into account your other health conditions, medications, mobility, and goals. What I've described here is general education, not a personalized prescription. 7. Prevention and healthy habits. If I could leave you with a short, practical list to protect your legs for the decades ahead, it would look like this. Move your legs against resistance regularly. Even bodyweight squats, sit-to-stand repetitions from a chair, or resistance band exercises done at home make a measurable difference. Consistency matters more than intensity. Don't skip protein at breakfast. Add eggs, yogurt, milk, cottage cheese, or a protein source to your morning meal, rather than relying on carbohydrates alone. Spread protein across the day, rather than loading it all into dinner. Stay generally active. Walking, climbing stairs when possible, gardening, and simply avoiding long periods of continuous sitting all help maintain muscle. Get enough overall calories. Undereating, which becomes more common with age due to reduced appetite, actively accelerates muscle loss. Your body will break down muscle for energy if you're not eating enough. Address sleep and stress, both of which affect the hormonal environment your muscles depend on for repair. Get regular checkups that include a conversation about physical function, not just blood pressure and cholesterol. Ask your doctor to check your grip strength or watch you rise from a chair as part of routine visits after age 60. None of this requires becoming a bodybuilder or overhauling your entire life overnight. Small, consistent changes compound remarkably over years. 8. Common myths and misconceptions. Let me clear up a few things I hear often in my practice. Myth: muscle loss is just an inevitable part of aging that nothing can be done about. Reality: while some decline is a normal part of aging, the rate and severity of that decline is highly modifiable. People who stay active and eat adequate protein can maintain dramatically more strength than those who don't. The difference between a fit 80-year-old and a frail one is often decades of daily habits, not just genetics. Myth: lifting weights is dangerous for older adults, especially those with arthritis or osteoporosis. Reality: when properly supervised and appropriately dosed, resistance training is not only safe but actively protective for joints and bones in most older adults. It's inactivity, not appropriate exercise, that tends to worsen these conditions over time. Myth: there's one specific superfood that stops muscle loss. Reality: I want to be honest with you here. There is no single miracle food. What the science actually supports is a pattern: adequate, well-distributed protein combined with resistance exercise. Any headline promising one food as a complete solution is oversimplifying real science for the sake of a catchy title. Myth: it's too late to start exercising once you're already elderly or frail. Reality: some of the most compelling research in this field comes from studies of frail nursing home residents in their 80s and 90s who showed real, measurable strength gains after starting supervised resistance training. It is genuinely rarely too late to see benefit, though the approach should always be tailored to current ability. Myth: if I'm not losing weight, I'm not losing muscle. Reality: this is actually one of the more dangerous misconceptions. It's entirely possible to maintain the same weight on the scale while muscle mass decreases and fat mass increases, a pattern sometimes called sarcopenic obesity. The scale alone doesn't tell the full story. If there's one thing I want you to walk away with, it's this: your muscles are listening to you every single day, and they respond to how you treat them, at any age. I don't say this to create fear. I've seen too many patients spiral into anxiety about aging, and that anxiety itself becomes paralyzing rather than motivating. That is not my goal today. My goal is the opposite. I want you to feel genuinely empowered, because unlike many conditions in medicine, this is one where your daily choices have an outsized, well-documented impact. You don't need to become an athlete. You don't need a complicated regimen. You need to move your legs against some form of resistance a few times a week, eat enough protein, especially in the morning, and pay attention to your body's signals rather than dismissing them as just getting older. Margaret, the patient I told you about at the start, she started a simple twice-weekly strength program with a physical therapist and added a protein-rich breakfast. Within 3 months, she was getting up from her garden bench without using her hands again. That's not a miracle. That's physiology, responding exactly the way we'd expect it to. So let me leave you with this. Muscle loss in aging is real, it's measurable, and yes, it's common. But it is not a passive sentence you simply have to accept. It is one of the most responsive, modifiable aspects of the aging process that we understand in medicine today. Your legs carry you through your life, literally, They carry you to your grandchildren, to your garden, to your front door and back again, to the life you want to keep living independently. Protecting them isn't about vanity or chasing youth. It's about protecting your freedom. Start where you are. Talk to your doctor about a functional assessment. Add protein to your breakfast. Find a form of resistance exercise you can stick with, even if it starts small. Your muscles are capable of remarkable resilience at 60, at 75, at 90, if you give them the raw materials and the demand to adapt. Take care of the legs that have carried you this far. They still have a long way to go.